Hi there, Dr. Nicola coming to you live on Saturday afternoon, and I've just been thinking about this idea that I'm learning in my, I'm going to an intensive training under Dick Schwartz's work, which is internal family systems, and it's this really cool approach to therapy, but in my case, my mind-body medicine, and that really talks about kind of these parts of ourselves that have been disconnected from our experience. And I had this really cool experience with a patient of mine earlier this week where as we were doing some of this work, she was able to really connect in with a part of herself that she's like, wow, this feels so much more like me, like who I really am, like my big me, my true self. And what was cool is that by simply quieting ourselves and allowing plenty of space for this person or this part to talk and speak from her own experience. She was someone who likes to spend time by herself and be quiet and reflective, and she's oftentimes kind of hammered by some of the other parts that have the to-do list, or they have other agendas, or they're afraid of being judged, maybe because they're going to be perceived as being lazy or not accomplished or fill in the blank, whatever our judge loves to do. And what was really cool is that as we started peeling back these parts that were jumping in front of the part we were trying to talk to, we acknowledge those parts, we have them go to the side, so that we can really have a conversation with this part of her who identified that she lives in the shadows. And simply by talking to her and presencing her and allowing her to have a seat at the table, all of a sudden it was like this whole part of this person I was working with was reintegrated and identified with and embraced. And she left feeling pretty amazing. And this time of year can be hard for a lot of us. I'll do a video on that another time. But kind of as we start kind of coming into the winter, out of the fall, it's a time where we are supposed to biorhythmically go inward and start looking at these deeper, darker pieces of ourselves, or at least reflecting on more of who we are. And a lot of us are scared by that, or we're resistant to that for one reason or another. And so what I'm here to tell you is if you have a sneaking suspicion that there's just something missing or something not quite right, there probably is a piece or pieces of you that have been exiled, that have been pushed out of your consciousness because somebody else, a different part of you, has a different agenda, doesn't have time for that part, that wants to sit and be reflective and watch movies, especially this time of year, which is PS spot on. And what we can do is we can start paying attention to those little voices inside of ourselves, or these inclinations that we tend to judge. We started having this conversation with this part because this person was saying that she wants to binge watch Netflix or just kind of escape. And what really was going on is that the reason that reaction was so big, like I don't want to watch this one movie, I want to watch 6 hours of movies by myself and not talk to anybody. What happens is that response is an equal and opposite reaction to how much she felt suppressed and alienated or exiled. And so when we bring these pieces of ourselves back to the table and into conversation, then we have a more direct line of communication, and we can say, what I really not need is quiet time by myself, not I need to hijack my whole weekend and binge watch a show, which sometimes works too, no judgment here. So anyway, my invitation to you for today is to kind of just take a few moments and think about any parts of yourself that might have been pushed aside, and are you willing to maybe open up the lines of communication and enter into some conversation, and simply presencing that part and letting him or her know, hey, there's plenty of room for you here at the table. Just notice what happens in your body. So again, my name is Dr. Nicola. I so look forward to connecting with you soon. Thanks so much for joining. Bye.